Tragically, 5 million people in India die every year because of medical negligence. They came to Calcutta from the USA in 1998 to maybe attend the wedding of somebody in their family. And on one evening, as people usually do, they went to probably their favorite Chinese restaurant. The next day, the lady discovered that she was developing rashes all over her body.
Have doctors been suspended in India?
It was in fact a case of prescription error at the outset, where the doctor prescribed an amount of steroids that experts later said should not be prescribed under any circumstances.
A disease like TEN is so rare that, whenever someone is giving patients drugs, if they want to aggressively treat it, they could never imagine in their wildest dreams that it would allow the skin to peel off their body. Arush Sengupta, welcome to Infinite Health. Thank you so much for coming today.
Thank you so much for having me.
Arush, I know you're a lawyer and I know this is a health podcast, but I really wanted to, talk about something that impacts everyone, but people don't really think about it, and that is medical negligence. And I wanted a lawyer's opinion on it because there's so many people who need to understand what medical negligence is. So, today I really want to talk about medical negligence like in depth so that there's so many people out there who are listening to this podcast know what to do, and how to go about it.
Right. So, there are two ways we can go about it. One is, of course, to get into the legal terminology as to what medical negligence is. The other, and what I think might be a more fun way of doing this, is to tell the story of one particular, or rather a set of individuals and one case. And while exploring the facts and the narrative of that case, we can maybe uncover one by one what constitutes medical negligence and what are the various parameters and what are the various nuances that the average person maybe needs to be aware of before they sign up for any medical procedure. So there was this case which went on for a staggering 15 years.
15 years?
Yeah, I mean, that's not unheard of in the legal system, but you would imagine that for something like medical negligence, the remedy would be quicker. It wasn't in this case. It started in 1998, but the final judgment was delivered by the Supreme Court in 2013. So let's just say it's X versus Y, because during the course of events, many people filed many cases against each other. And to get into all of it would kind of complicate it. But what basically happened was that a couple, a doctor and a PhD student.
So the doctor was the husband.
The doctor was the husband.
Right.
And his wife. They came to Calcutta from the USA in 1998 to maybe attend the wedding of somebody in their family. And on one evening, as people usually do, they went to probably their favorite Chinese restaurant. And the next day, the lady discovered that she was developing rashes all over her body. Now, rashes are a very common thing. Nobody, like if you and I, we have rashes, we'll not get alarmed, we'll not panic, So they just called their family physician. And because the husband was a doctor, of course, he got in touch with the best in the city. And at first instance, the doctor just did a preliminary checks, didn't find anything outrightly very wrong, and said, okay, rest for 7-8 days and we'll take it from there. And there was no medication even prescribed at that point. 7-8 days hence, this lady found herself getting progressively worse, The rashes started getting worse. Some skin had started to peel off. Blisters had started forming. So by then they had kind of figured out that it's not something as casual or as innocuous as it seemed to be.
And the Chinese food had caused it.
It was never conclusively established what exactly caused it.
So it was idiopathic.
Yeah, perhaps. But that was the only thing they did which was out of their maybe usual routine. So that was one thing that has been
There was no way to say, but
as to whether conclusively that was what, there was no causal link established with that. So anyhow, then the doctor, again after re-examining this lady, diagnosed her with having some or the other kind of allergic vasculitis. Now I'm sure you would know what that implies better than I would. And gave her a dosage of steroids. The name of the steroids escapes me. It was dopamedrol or some such thing.
That's not a problem.
Yeah. So, but what happened thereafter was that instead of getting better, this lady progressively deteriorated. till such time she had to be admitted to the hospital roughly around 10 days to 2 weeks from the onset of symptoms. And and that was when the doctor of the first instance, who was their family physician, it was at that point that he decided that it might be a good idea to have a dermatologist, have a look for a more expert opinion. And then the dermatologist, once he examined her symptoms, he found out that what she was suffering from was a very rare disease called TEN, which I think stands for toxic epidermal necrolysis.
Right.
Yeah,
Very rare disease.
it is. I think it's 2 people in about a million.
Right.
That's the rate of incidence.
So, in layman's language, let me explain to the audience what 10 really is. 10 is an extremely, extremely rare disorder. I don't know the statistics in India, but in the US, it's approximately 2 people per million patients get this. And this is just an autoimmune reaction to certain drugs, infections, bacteria, tumors. It could be anything, and more often than not, it's idiopathic. And, 30% of the cases are fatal when it comes to this. And it's literally your skin peeling off your body faster than your skin can come back. So it's not just painful, it's horrible to look at. I think everyone needs to have a wild imagination to just imagine I mean, if you guys see Dr. House, please go see Dr. House at season 4 and you'll know what toxic epidermal necrolysis is.
Right, and this patient who we are talking about, by the end of the progression of her disease, every part of her body was without the top layer of skin other than her skull. Like, I mean, that's a grotesque sight.
Yes, very.
And she was fully covered in bandages by the time her treatment progressed in Bombay. So he gave her an increased dose of a different kind of steroids. I think steroids, if I'm not mistaken, are of 2 types. One is a long-acting, one is a short-acting steroids, and apparently they take effect at different times.
Correct.
And but even then, rather than improving, the lady continued to deteriorate till she was so critical that almost 80% of the skin in her body had peeled off. It was
Completely peeled
completely peeled off. And there were greenish tinges on her body, and she was unable to eat, and there were no supportive therapies prescribed.
Sounds really painful.
It was. And that was when they airlifted her in a chartered air ambulance to Breach Candy Hospital in Bombay.
Okay.
Where the doctors who saw her come in were really alarmed as to what has led to the state of affairs that, she's being brought in this extremely critical stage of the disease. And then they tried their best to kind of do what was necessary, but sadly it was too little too late. And eventually the lady passed away roughly about a month from the onset of her symptoms. So obviously the husband was devastated, as anybody in his place would be. But being a doctor himself, he was also aware of some critical flaws which had taken place in the duration of the treatment. And perhaps a layman in his place would not have. And even though he wasn't a dermatologist, there were some, in his opinion, very basic errors which were committed. So for instance, the fact that there was an excess of steroids which were administered. And it occurred to him that was this the right course of treatment in the first place? So he went at the first instance to the consumer forum. Because in our country, of course, medical negligence is dealt with in 2 routes as far as our legal system is concerned. One is to establish whether or not it's medical negligence amounting to culpable homicide under the Indian Penal Code. And the other is to understand whether or not it's deficiency of service.
So, Arush, just to simplify it for the layperson, I mean, for me, medical negligence, because I've been in this field for a very long time, if the doctor fucks up,
Right.
I would just colloquially call it, he fucked up, so it's medical negligence, right?
Right.
But what does it legally really mean? Because you were talking about courts and everything. I mean, it's just, maybe it is a stupid question, but aren't doctors allowed to make mistakes?
No, of course they are. But what we as lawyers have to check, and what even the clients, because it will eventually impact what remedy they get from the courts, is whether it is negligent enough to be called criminal negligence. In which case, as we all know, you need a degree of proof which is beyond all reasonable doubt that the person intended criminal consequences. And that is not something you would normally accuse a doctor of. No matter how bad he is as a doctor, he may be the worst doctor in the world, but you'll not say he's out there to do you criminal harm in that manner of speaking.
Unless the doctor is a serial killer.
Unless the doctor is a serial, in which case, why would you go to him?
No, I mean, we
But-
would not know.
no,
But
we would
yeah.
not know, but then that's a separate, it's not
Right.
negligence.
Okay,
I mean,
fair
it's
enough.
something he's doing
It's something he's
because
doing
he
separately,
intends
yeah.
to. The other, and which is often the more practical remedy, is to approach the consumer courts, because for the last 30 odd years of
So
our
that's the lowest court.
no, it's not the lowest court. It's a court which deals exclusively with deficiencies of products and services that we are buying every day in the marketplace.
Okay.
And the Supreme Court has held that even the services that a doctor provides, no matter how noble the profession might be, no matter how, exalted his aims and so forth might be, it's still nonetheless a service. It's a service that you're going to a marketplace, for lack of a better term. You're paying money and you're getting a certain kind of service. So it should be treated at par with any other thing, like, say, for example, again, not to trivialize the profession, but like at par with maybe a plumber, or you get what I mean, or a
Correct.
car
Okay.
mechanic, and so on and so forth. So in that case, what the person who has faced some kind of damage or harm has to prove is not whether the doctor was criminally negligent, not that he intended to cause death or any such thing, but just whether or not the level of service he provided was deficient. Now, if a computer guy comes to fix your computer and instead installs a virus, would you say that he's been deficient in providing the service he was supposed to? Of course you would. Now, similarly, like a doctor, if you go to him for a surgery, but you find that he's left an instrument inside your body,
Which has happened.
would you say that he's been deficient in providing the service you paid him for? Of course you would, And in this case, the question of whether or not he's criminal doesn't arise. It's not relevant. So, while he's not liable for imprisonment or any such thing, he will, of course, be asked, or the hospital will, of course, be asked to pay the person
A good amount of compensation.
money for the harm.
But just off topic, like, statistically, have doctors been suspended in India? Because as far as I know, in the last 10-15 years, no doctor has been suspended in India.
No, and for the same reason, because to prove that somebody is guilty of professional misconduct is a very, very high standard of proof.
And is almost impossible.
It's almost impossible because, like in this case that we were talking about, so there was a whole battery of doctors treating this person. They were all liable of some degree or the other of negligence at some level, It was very difficult for a judge, and a judge who's not a medical practitioner, even with expert opinion, and they had expert opinion in this case, to say that whether one person is more liable than the other. When there's a team of 5 doctors treating a patient and the effect of the negligence is cumulative, you can't really say that, okay, these 4 people are a little negligent, but this one is criminally negligent, or this one in particular deserves to be suspended for professional misconduct. So it often comes to that, because whenever we go to a doctor, especially when we get admitted to a hospital, there are multiple doctors who are treating somebody at various levels of expertise. So it's tough for a lay person, which is what a judge is in medical terms, to say that this person is especially guilty of,
Right.
medical negligence. Of course, the Indian Medical Council might be able to make a more informed assessment, but yeah, they are typically reluctant to.
But just to summarize, like, if I'm a patient,
Hmm.
right, and if I'm going to a hospital for a surgery, because I think most people who file for negligence would do it for something more serious. I mean, not for a prescription error, maybe.
Typically.
Right? Because prescription error would be very common. But I mean, something, or it could actually happen. But anyway, like
Or
something.
at least the consequences need to be severe, not
Right,
necessarily.
right.
Yeah,
And so
yeah.
if a patient is going in for a surgery or something a little more serious where the prescription error could be very fatal, right? What can a patient do, right, to protect himself? Like, because you're a lawyer, so you would probably know what documentation needs to be proved, right? So what is exactly that the patient needs to be very mindful about when he's going for a medical treatment?
Right. So again, in this case that we started off with discussing, the 10 case, It was in fact a case of a prescription error at the outset, where the doctor prescribed an amount of steroids rather, uh, that experts later said should not be prescribed under any circumstances. So it's not just something that was wrong for this particular disease, or a 20% error in judgment that maybe 10 mg was substituted with 15 mg. It was four times, five times the maximum level that was the recommended use of that.
How many times?
Four or five times the maximum, the
4 or 5 times
yeah,
the recommended dose.
yeah,
Okay, that's very high.
that is very high, and that's not a minor error of judgment.
Right.
So, which is what in fact led to later the quantum of compensation also being an unheard of 6 crores,
Oh, wow.
which was awarded eventually to the family of this.
And after what, 15 years?
Yeah. So of course they calculated interest and they calculated the loss of income over time, and all these other relevant factors. But it was still an unheard of amount in Indian legal history.
Right. So it was like a very landmark judgment there.
Of course, it is in fact the judgment that people still refer to when they talk about medical negligence.
So again, I'm just coming back to the patient. So if a patient goes to a clinic or hospital, wherever, whether it's a surgery, whether it's an OPD, I mean, the first thing that we or the patients need to do is have all the prescriptions correctly written, right?
Absolutely.
Is there a certain format that legally say that the government allows, like this is how the prescription should be written with their registration numbers and things like that?
Of course, the registration number should be, as far as I'm aware, there on the letterhead itself, or at least below the signature and the stamp of the doctor. But anything that is more or less intelligible is good.
Okay, so I just want to, for the audience, I just want to, like, put this out there. Like, whenever you go to a clinic, I mean, make sure that you're recording every single prescription, sorry, for your patient or loved one, so that you can keep recording it. Because the fact that if you don't have all your prescriptions in order, and I think chronologically placed, you will bear the brunt of it in the end if something wrong happens. Am I right?
Of course. And also don't alter or change the medication without having it written, because in this case there was a suspicion of even that having happened, because this lady's husband was a doctor. One of the defenses that the negligent doctors took was that her husband, prescribed stuff that we didn't sanction, or he refused to give her the medicines that we sanctioned. So how is he not equally liable?
That's a very interesting point.
Yeah, yeah. But again, we get back here to the theory of what is medical negligence, So the first thing you have to establish in any court is whether or not that person owed you a duty of care in the first place. Now, of course, the husband is anxious as to how proceedings unfold, but he does not owe a duty of medical care. He may be a doctor, that is separate, but the primary responsibility is that of the doctors who are actually overseeing the patient, who are actually writing down the prescriptions and are supposedly experts in their field. So which is what was the conclusion that the Supreme Court also came to, that sure, he may have, maybe at times overstepped his limits, but that does not mean that the negligence of the treating doctors were any less. You can't use that as an excuse to say that I wasn't negligent.
Right.
Because your prescription was in the first place wrong and several times the maximum recommended limit.
I want to say something controversial here, and maybe a lot of people will not agree with what I'm saying and they might lash out. But, like, I've been practicing clinical research for the last 12 years, and, like, we do so many new drugs, medical devices. And something that I've heard a lot of doctors say is that the gold standard, like, you said recommended dose, right? You said the gold standard set by, whether it's the WHO or the government or certain medical bodies like the ICMR or the IRA, is basically very standardized, which might not be applicable to everyone. Like, imagine an 18-year-old 50 kg kid might be taking 500 mg of crocin for his headache, and me, who's probably double his weight and double his age, might be taking the same dose of crocin. So, in a medical sense, that doesn't make sense, right? And I know this is a very controversial statement, and I'm in no way trying to defend the doctor. I mean, because obviously I don't know the case, and, I don't know what the doctors prescribed and how the patients did it. But I mean, it could be like, it's just, I'm just putting it out there. It could be that sometimes doctors take a more aggressive approach to certain things, because a disease like 10 is so rare, is so rare that, whenever someone is giving patients drugs, if they want to aggressively treat it, they could never imagine in their wildest dreams that it would allow the skin to peel off their body.
No, so I get your point, and it's a valid point. But what exacerbated both the patient's condition and the eventual plight of the doctors was that, sure, one could have said that at least as far as the dose was concerned, you can give the doctor a certain amount of benefit of doubt, and why not? But what they also did in this case was, once they saw that the steroid was backfiring, so to speak, uh, the secondary line of doctors who came in, the so-called dermatologists and the others who had more expertise in that particular disease, instead of tapering down that dose, they added more steroids to that
Oh,
equation.
okay. You're saying more than 4-5
Ye-
times and added more.
huh.
Okay.
And
That's insane.
and even if we leave aside the question of steroids for the time being, so apparently this disease is primarily treated with also things like nutrition and ensuring that there is enough fluid intake and ensuring dressing of the wound from time to time at regular intervals and checking the vital parameters of the patient. Not one single thing out of these various things happened at the hospital concerned for a period of 10 days. So for 10 days there was no attention paid to the nutrition, no attention paid to the intake of fluids, and no attempt to even check the parameters like the pulse, temperature.
Absolutely crazy.
Yeah. So even if we were to leave aside the question of the nature of the medication and the correctness of it, there was negligence at so many levels that it was very difficult for the doctors or any lawyer defending them to say that, I mean, at which point do they start to defend
Right.
really?
Right.
And the nurses had that excuse that apparently because of the chance of infection, they did not enter her room. Now, can you imagine this excuse being given to somebody from our family who's admitted to a hospital, and a nurse coming and saying that, oh, we did not treat her because, we were scared that there would be
That's horrible. Yeah.
yeah. But that was the excuse that they took. And which was also why eventually the hospital was asked to pay the highest amount in compensation, because medical negligence is one thing, the doctor failing to exercise professional skill is one thing, but for an institution not to ensure that the people it has on its payroll to do what they're supposed to do in a diligent fashion, it's something that nothing can control, nobody can control. And if this is allowed to continue unchecked, anybody's life can be at risk for even a small procedure. If a nurse doesn't show up for weeks at a stretch, can you really imagine the plight of
No,
patients?
absolutely. That's horrible.
Yeah.
But I mean, for the case that you're talking about, I mean, of course, it's an extreme case. But when should a patient really think of filing medical negligence? Because, I mean, of course, if a near or loved one dies, I mean, like the families get devastated, like, they completely break down. And, the thought of filing a negligence lawsuit against a doctor is natural, I guess, in so many ways, because in some way or the other, you will feel that the doctor did something wrong and that I need to file a case. But I mean, just on a very practical level, when should a family actually file a negligence case? I mean, what are the things that they need to study before they even take a step? Because it's a very tedious process to file a lawsuit.
To be honest, you can break this into black and white, because in most of the cases, the families are acting out of emotion. And you can't deny them that leeway. They are not expected to study legal textbooks if they want a remedy for something that they think has gone wrong. And usually, to approach a court, all a person needs to be convinced of is that they think something has gone wrong. After that, it's for the court to decide. But in general, like you asked, that can't a doctor also make mistakes? The mistake cannot be of a nature that is totally against all established, protocols of treatment. Like in this case, had it been a question of administering steroid A versus steroid B, then sure, it's not negligence, because these are two acceptable ways of treating the same disease. It's a doctor who, in his professional discretion, has chosen one way and is backfired. But when 10 experts are saying that you can't do this, you can't give this much of this particular medicine under any circumstances whatsoever, then of course you can say that there has been recklessness. The doctor had no idea what he was doing. And that can't be the case.
But do you have any idea how many people file medical negligence cases in India? Or just like a general statistic, like, because I'm also thinking about doctor rights here, but anyway, go on.
I mean, no, but it would be in lakhs at least,
In
because
lakhs, like,
because at least the consumer forum, which is the first instance of approaching court, in a month, a particular district would have roughly anywhere between 1,000 to 2,000 cases.
that's crazy.
Yeah, so now you multiply that with all the districts in all the states and all the higher levels of appeal. So you have quite a few cases.
So it's just such a, I mean, those cases would just pile up, right? I mean, because I'm just thinking out loud, if a doctor hasn't been suspended for the last 10, 15 years, I mean, most cases is where you can't prove any form of negligence. Am I correct?
Yes, so what happens is most people, if they lose the case at the first stage, very rarely do they appeal to the
Again,
higher courts. Of course, in this case, the appellant being a doctor, he knew what exactly had gone wrong, and he knew the merits of his case, and he had the money to fight it out till the Supreme Court. But usually, most people don't have, again, let alone the finances of it, even the emotional
right.
bandwidth to really pursue it.
So the patient's family, the maximum that they can do is just make sure that all the prescriptions and everything given to them are recorded and put. Do you think even home care needs to be recorded by the family? I mean, if, say, for example, if my family member is going through terminal disease, I mean, should I also record everything that I'm giving them at home?
In your personal capacity or under supervision of a doctor?
Both. I mean, in my personal capacity also, because
I
but
mean,
would that be admissible in court?
in your personal capacity, if it's not under the instructions of a doctor, it's not as such connected to medical negligence by a professional.
I'm just thinking out loud here, Arush. Like, what if a doctor comes out and says that, listen, I don't know what the family is doing at home? Like, you
Right,
are blaming it on my medicines.
right,
Maybe my medicines are not to blame for. I mean, just as an argument that I'm
right.
saying. Maybe you gave them something Ayurvedic, or maybe you gave them something homeopathic, or some, herb that you might be allergic to, or had an autoimmune response in your body.
Right,
I mean, how do I know what you're giving them at home?
right. So, in fact, in this case, that was the defense that one of the doctors had kind of taken. That by the time I got involved in the treatment, the situation was so far gone that what could I have done? But the court held that precisely because that, in your opinion, the situation had gone so far, it was your responsibility as a professional to do more research on the background, on the history, and spend some more time rather than just prescribing what you could off the cuff or saying that it was somebody else's fault. In fact, what the Supreme Court came down very, very heavily on all the doctors was the fact that they played a blame game. That one blamed the other, who in turn blamed the other, who in turn blamed somebody else. So that is in fact what counted very heavily against them in the final analysis, that never mind what anybody else did. The question is whether you exercised as a doctor the amount of care you should have.
Right.
And if you didn't, then no matter what somebody else has done before you, whether that person was family or another professional, it does not absolve you of your responsibility.
Right.
So that was, I think, a very proactive kind of a judgment.
I think this brings us to a very important point, which you just brought out, is medical history. Because I don't think people in India really understand the concept of medical history really well. Like, they don't record everything that they're doing. They don't tell the doctors everything they're doing. I know I might sound like I'm defending the doctors in this case, but I'm really not. I mean, I understand that there's so many doctors out there who might be making errors in judgment, and being negligent overall. But I mean, what I really want to ask is, um, what is the difference between negligence and fucking up?
So the difference between a doctor just fucking up in the usual course of his day-to-day life and being negligent is that for him to be negligent, it's not enough for a patient to say that he did something and it turned out wrong. As long as that was within the accepted standard of practice, even if it went wrong, even if it's an error of judgment, even if it is maybe taking a risk, you can't say he was negligent. Negligent is when he did something that no person in his place, in acting in their right mind, would have done. It has to be that degree of carelessness and recklessness almost, that anybody would have known that being this reckless can cause harm to a patient.
Right.
And then it's negligent. Not somebody who says, who has a choice between option A and option B. Maybe option B is riskier, but he goes for it nonetheless and it backfires.
So it's not really fucking up. It's basically mindfully not doing something that you were supposed to do.
Yes.
So, I mean, when I say fucking up, it's just like making a mistake. Oh, I dropped something. Oh, I did something wrong. Or I gave a wrong dosage.
Again, dropped something, not maybe dropped something in the patient's body and sew
Okay,
it
yeah,
up
fair
later.
enough.
Because again, that is something you would say that it's
Negligence.
yeah, not something that somebody in their rational minds should be excused for doing. But say, for example, if say there's a cancer patient, and surgery and chemotherapy are equally valid methods of treatment, but the doctor chooses one over the other and it backfires. Let's say he chooses surgery, but instead of stopping the disease, it somehow progresses. So, and this has happened and this question has come up before the courts. What the courts want to know is, given the disease, is surgery an acceptable way of treatment in the first place? It need not be the best treatment. It may be that the alternative could have worked better for the patient, but is surgery acceptable in the first place? If yes, then even if it's not the best course of action, even if it was not the best exercise of judgment by the doctor, it's still not negligent.
This brings me to a very interesting point because you brought chemotherapy. Because, we've been dealing with cancer patients and chemotherapy trials for like the last 12 years. We actually completed our 12th year yesterday. But there was a recent case where a patient was given, and this has happened with my patient several times. There was a recent case where a patient was given like 6 cycles or 12 cycles of chemotherapy, and that they later diagnosed that the patient did not have cancer. Right? So, are labs or the hospitals also liable for negligence? Because if a lab tells me that this patient has cancer, of course I'll prescribe chemotherapy.
Again, that's a bit of a gray area. But in general, the thumb rule is that the more complicated the case, the more the gray area, the more the responsibility of the doctor and the hospital to do their due diligence.
There are so many deeper layers to this and so many nuances to this. Because if a lab gives me a result, right? And these are expensive tests, like these tests cost 10, 15, 20, 30,000. Am I supposed to do those tests again and again or check with other labs to see if the diagnosis is correct or not? Right? Because I'm just thinking as a healthcare provider that, like if a patient comes to me and they tell me that it's cancer, I have to believe that it's cancer.
But again, perhaps, so you said that several rounds of chemotherapy had happened on the basis of this erroneous diagnosis. Would it not be, obvious to the average doctor after, say, 2 cycles that there's something amiss?
I mean, I guess, for some protocols, maybe that could be seen, but 6 cycles is usually the standard protocol.
Okay, let's say the bare minimum.
Yeah.
Let's say he does the
And
first.
that's why after 6 cycles, the patient was seen that they did not have cancer, is because they probably did a radiological test again and they checked the tumor again to see whether they have cancer markers or not. And maybe it showed that those cancer markers, the tumor cells were so healthy that it couldn't have been cancer in the first place.
Right.
Like, because you don't go into complete remission right after 6 cycles. But anyway, go on.
Right. So again, the test in this case would be whether or not, given the material that was available to the doctor, did he do the right thing?
Right.
Now, of course, if a doctor goes to doubt every single report or ask for every single report that is presented to him to be cross-checked, there would be no end to it.
Right.
So perhaps like maybe after the first round of treatment, if it seems to him that obviously this is not working, if then he continues that same course of treatment, yeah, there might be an element of negligence. But I don't think it's the doctor's prerogative to assume with no further information that the report of a registered competent lab is necessarily wrong.
Wrong.
Yeah.
Fair enough. But this brings me to a very important aspect of the conversation I needed to have with you, because it's a very legal question, is of the informed consent. I mean, like, there was a conference in Helsinki about it where they formed the good clinical practices, and they came out with how patients needed to be consented before you could do anything with them, right? I mean, how important is for people to read informed consent? Because I can tell you from my experience, patients do not read the informed consent forms.
Very important, but there are, of course, two elements to this. That getting the consent is the doctor's prerogative, sure, which, as far as I know, they usually do in some manner or the other. But again, the fact that the patient does not read the form in the first place is not strictly speaking the doctor's problem. Again, like in the case of the lab report, it's not for the doctor to assume that the patient wouldn't have read what they are signing on. So you can't hold the doctor liable for that. But if they go out of their way to misrepresent the disease, and I think this is there in the medical council guidelines, that if you deliberately underplay or exaggerate the gravity of the disease, then sure, of course, then there would be a case of negligence.
No, I'm just saying that consenting is such an important aspect of my business. So I'm just giving you an insight into that. Is that legally it is dictated that the doctor needs to consent the patient,
Yeah, sure.
right? That's on one hand. Now, let me give you another statistic. There are 1.5 doctors for per 1,000 patients in India. So my question is that with crores and crores of patients and just 1.5 doctors per 1,000 patients, how practical is it for a doctor to actually go and consent so many patients for half an hour? They'd probably, give their whole time up just to consent patients.
Exactly. So again, correct me if I'm mistaken, but what probably happens is there's a standard form, there's a standard
Let people
template,
sign.
and it doesn't take anybody much time. So like we were discussing, it's not the doctor's problem to make sure that he sits down with the patient and explains every line to him thoroughly.
Right.
So it is equally the patient's prerogative to, again, not only know what they are signing, but to know what their medical history is in the first place.
So, would you advise anyone and everyone who's going to a clinic, hospital, doctor, wherever it is, surgery, that they need to read the consent form very carefully with all the terms and conditions?
Absolutely. And even if it's a very complex consent form, even if it is 20 pages with a lot of legal terminology, I mean, by all means, like, take as much time. Sometimes you don't have that much time.
Right.
So, but let's assume that these are exceptional circumstances. Usually you have as much time as it takes to read that form. So it's mandatory to read it. Like, and this is not even law of medical negligence by itself. It's basic foundational law of contracts. Any contract that you're signing, the courts will assume that you know what you're signing on.
Right.
And if you don't know what you're signing on, it's
your fault.
It's your fault. It's not the other person's fault.
There is a very interesting question I have, and it just cropped up in my mind. I don't know why. But there's so many patients who die in the hospital, right? It could be cardiorespiratory failure, stroke, aneurysm, whatever it is. But we live in such a religious country that once the patient dies, and like people don't really doubt that, whether it would be the medicines or something that the doctor did, right? I mean, you will never know. There's no statistic for that, right? How many families really get the postmortem done for their patients to prove that there could be any negligence?
Strangely enough, now that you ask me this, in all the cases on medical negligence that I have read, not one single one was based on a postmortem. It was all based on the cumulative history and the series of prescriptions and the series of reports and paperwork that accumulated in the hospital while the patient was still there. So perhaps that's indicative.
I think also because I don't think a lot of hospitals in India would have a postmortem lab facility. Like that, because patients are dying in small clinics in India and so many small district hospitals.
No, even if they do, usually it's been enough for the courts to rely on the paperwork that was kind of produced during the course of treatment as indicative of whether or not that line of treatment in the first place worked. Because if that is enough, I don't think, because to the best of my knowledge, I don't think even postmortems at times are really conclusive. I mean, you would know this better,
Right.
whether they are.
Actually, I was thinking of murder cases. Like, because in my head, it was like if someone wants to prove, there's so many relationships where the husband dies or the wife dies at a very young age,
Hmm.
right? And then there is a murder trial that is formed. Like, the wife's side feels that the husband might have poisoned her. Uh,
Right. So maybe that's, because if somebody poisons somebody from an otherwise healthy state of being, you can't establish that in any manner but a post-mortem. However, if you're, let's say, again going back to an earlier example, establishing the result of successive doses of steroids, that's already there on paper
right.
in that sense. So, I mean, if you can say that that's led to a critical condition, that's good enough. You don't need the patient to even necessarily always die for it to, again,
Yes.
without trivializing it, for it to be medical
Because
negligence.
I'm not trying to create a conspiracy theory,
Right.
but there's so many patients in India today below 40 who are dying of heart attacks, right? And it would be such an easy thing to use to, if you wanted to kill your partner, you know, like because if your partner had a heart attack, they would just assume that, maybe he was a smoker or a drinker and like, something
COVID
happened,
vaccine.
a COVID vaccine maybe, and that the patient died and, and that they would just cremate him or, burn him
Hmm.
if, depending on what people believe in. And that's it. That's about it.
Right. So that is what also I was getting at, that in order to establish foul play, perhaps you need to consider whether or not something extraneous has been introduced into the body.
Right.
But when we are talking about medical negligence, we are typically not talking about foul play. Of course, we did speak about criminal negligence where it almost amounts to foul play. But for the standard doctor, you can't say that it's so far gone as to be foul play.
Right.
That he did something he was absolutely not supposed to do. Usually, the things that he has asked the patient to consume, etc., they're already documented. You already know that the patient has had, say, for example, these many rounds of steroids.
Right.
So I suppose in that sense, it's not necessary to go all the way to till doing a post-mortem to establish
Okay.
what could have led to this. You
Okay.
already know it's there
So,
on
but
paper.
just like for the audience, I just want to summarize what we've discussed so far. I mean, the first thing that everyone needs to do while entering any facility for any small or big treatment is read the informed consent form.
Yes.
Number one, like read the consent of what you are accepting.
Yeah.
Right. And number two is that whatever and whenever and however, whichever treatment is prescribed to you, whether it's a prescription, whether it's anything for that matter, that patient needs to record everything chronologically.
Absolutely.
Right. And for all the listeners who are listening to this podcast, there is an app called Eka Care, and this is not a paid promotion. Please go onto that app and actually register all your medical history, whether it's your blood report, whether it's your self report in that app. I think that really helps. So I think recording your medical history chronologically, everything that the patient has done, including medical history like smoking, drinking, weight, height, your personal tests that you've done, your movement levels, your activity levels, everything needs to be recorded, correct? So that's ICF, that's medical history, that's prescription, and there is
Also, if you suspect that there's been any adverse reaction to any prescription, as much as you can get a second opinion and record that too, because sometimes, and not in fact sometimes, in most cases, it is the second opinion which establishes whether or not there has been negligence in the first
so for
place.
serious cases, you're saying they could go for a second opinion also.
Of course.
That would establish a certain level of coherence.
Exactly. And the deviation from normal, like if you're saying that the first doctor did something which was absolutely not standard practice, it's not for you or me or the judge to come to that conclusion. The only person who can come to that conclusion is another doctor or
Right.
another body of doctors.
Right.
So if you suspect that something is going very wrong, the only way to prove it in a court of law is to have another medically licensed person, testifying to that effect.
Right. Fair enough.
So, in fact, tragically, 5 million people in India die every year because of medical negligence.
That's 50 lakh people.
50 lakh people. And what is more surprising is that the same body of researchers.
Sorry, I'm just interrupting for a moment. These 50 lakh people that you're talking about, they're proved medical negligence or they assumed medical negligence.
I would imagine that there's somebody who's at least claimed medical negligence
Right,
in
okay.
some forum or the other.
Right, okay.
Again, you can't.
And it's been proved to a certain extent,
certain degree
maybe.
that there may have been something off somewhere.
Right.
But what is more surprising is that only 2.5 million of these are preventable,
Okay.
which leads us to the conclusion that 2.5 million deaths by negligence happen, which, at least according to the study, and I don't certify its veracity or
Hmm.
anything, at least 2.5 million of these are not preventable.
Right.
Now, why is that so? I mean, it's a bizarre statistic
No, but
to
it's also a
think
very
about.
spiritual point. Like, it's like you were meant to die.
You were meant to
Like
die. Yeah,
negligence wouldn't
yeah.
have affected it anyway.
Right, but but there were some follow-up findings that they came up with. One of them was that doctors as a whole don't know how to deal with critically ill patients.
Right.
So, and because many people at least in India, only go to a hospital once their problem has kind of assumed a certain
Right.
significance. Maybe it's both ways, sure. Like the doctors don't have enough resources or they aren't equipped to deal with critically ill people. But many people are also choosing to go to a doctor in the first place when they are critically ill
Right.
and not earlier. So that also has to do with maybe a need for people to be more aware about their health right from the beginning, not wait for there to be an emergency before they start going to a doctor. Because it's not just the doctors who are negligent, sometimes it's the patients who are equally negligent over a cumulative period of time.
I mean, even though, I don't want to put it in a negative way, but I also feel that the government also needs to start spending more on infrastructure development. And I'll tell you why. I mean, when patients are critical, they need certain critical tests done then and there. I take full responsibility when I say this, that 90% of all the hospitals in India don't have the right infrastructure to test for critically ill patients.
Right,
Like, if you don't know which fungus, which infection, which pathology is causing that problem, how do you even treat it?
right,
If a patient comes and, he has a stroke or a heart disease or whatever it is, I mean, if you can't do the PCR testing for which specific infection is there, right, how do you give the right antibiotic for it? Because most doctors would be like, give them the broad spectrum antibiotics.
right.
So I do feel that the government spending on healthcare is so low in the country. While we do need a preventative policy for people not to die, or for people to have better, healthier lives, to prevent those 50% cases which could be preventable
At
probably,
least, yeah.
but also have an healthcare infrastructure where every hospital is equipped to do those tests
True.
that the patient deserves.
And to again go back to the case you're talking about, and perhaps this is why it was such a landmark case, because it encompasses so many things. Uh, so on the question of on what ground was the hospital negligent, uh, they did not have a burn unit, and the nature of the skin injury suffered by the person here
Constitutes for burn
constitutes and
injuries.
warranted a burn unit. But it was held by the court that since hospitals aren't compulsorily required to have a burn unit, that is not why you can be held to be negligent. So the bar is actually quite low as far as the minimum standards are concerned. That okay, if you don't have oxygen cylinders also, that's a bit much, but burn unit ICU, this we'll let go. This is not negligent.
Right.
So the minimum bar for the level of infrastructure is also quite low.
Right.
That
I
you are
mean,
allowed to function without having these
so
facilities. And
infrastructure is definitely required.
yeah,
Definitely,
yeah,
definitely required. I mean, along with preventative health, I feel like preventative health is so important. Like, most people don't know what they're allergic to. Most people don't know what they would react with. I think these need to be brought in. Like, we did this reel on how genetic testing is important for, to find out whether your child could have a potential thalassemia or sickle cell anemia and whatnot. And I feel like, apart from preventative policy, I think the government really needs to start spending on healthcare and be conscious and aware about it.
also the citizens, again in this case, we don't know whether it was Chinese food, but since it's mentioned in all the texts,
Right.
we can maybe assume that it had something to do with it, but the person did not know. Maybe if they were more cognizant about the things they're allergic to, they would have at least avoided maybe whatever
Out
it
of
was.
context, do you know the name of the
No,
restaurant that
that's
they
not
went
been
on?
mentioned. Maybe that doesn't exist anymore.
Because I'm just thinking out loud, like, what happened to that restaurant? Like, because if it can cause something to one person, maybe it infected other people as well. Because again, since the Chinese restaurant was mentioned again and again.
Right, it was. But also there's a 1 in a million case.
So, since we were talking about government spending on health, where do you place health insurance in negligence? Because there's so many times, I mean, people are like, the health insurance is not covering my money. I mean, how aware should a person be for his health insurance? Because these are like fucking 100-page documents.
Typically, they are not. For instance, they don't even read the exception clauses. Every insurance policy, I'm sure you would know better than me. There are some cases which, if you haven't disclosed a pre-existing condition, you won't get coverage for
Right.
XYZ disease.
Right.
But so, for instance, if your policy says that you won't get coverage for heart attack if you have high blood pressure and you haven't told us, but you don't know in the first place whether or not you have high blood pressure. Again, that's not the fault of the insurance provider or the hospital. I mean, it's for you to be more aware, be more accurate, be more overall more with the program as far as these things go.
I think both parties are at fault here, because what happens is the patient could give an argument that, listen, I wasn't aware that I had high blood pressure.
But why not? I
Right. And the
mean,
insurance would be like, you should have, when we took your health insurance, we asked you
we
whether
also
you
apparently
have
we also apparently give you one free health checkup every year
every year,
to
and you
ensure
don't
that you know
and you
these
don't take
things
it.
and you don't take it. So it's not the insurance
No, fair
guy's
enough,
fault
fair
in
enough.
that sense.
But like, Arush, this has been such a lovely conversation. I'm sure, the audience will take so much out of it. And I feel like this is something that patients need to be more careful about, and even doctors and the health fraternity needs to be more careful about, and even the government needs to be more careful about, because only together, when all the three systems come together, the society, the medical fraternity, and the government, can we really help take the nation forward when it comes to the Viksit Bharat plan, or when it comes
Of
to,
course.
creating a better healthcare infrastructure.
Of course.
But Arush, thank you so much for coming. It was a lovely conversation. I hope to see you back again.
The pleasure was all mine.
Now, before we end, I'd like to thank our sponsors, Decodeage. Decodeage is India's first longevity research company aiming to increase the health span of people. The supplements and tests are based on the latest scientific breakthroughs in the field of longevity and aging science. The supplements they provide target the biological mechanisms that cause aging. For example, as we age, then NAD plus levels in our body decline, leading to mitochondrial dysfunction and genomic instability. Two main reasons for biological aging. Now, by supplementing with Decodeage's NMN, one can replenish the NAD levels in the body and tackle aging at a cellular level. Now, there are numerous clinical trials and experiments indicating that NMN increases the health span of individuals who consume it. I take it myself and it feels great. Apart from NMN, Decodeage offers other longevity supplements like spermidine, AKG, fisetin, and transresveratrol. If you want to start your healthy aging journey, then Decodeage is the place to be. Do visit decodeage.com and use my coupon code ANANT to get a discount.